There are two stagings that I've been given. One is from the radiological report, and that is done via CT and MRI scan of the pelvis. And the staging for that is T4A, N for Norman 2, M for mother 0. And then if we move on to the post-surgical one, which is done under the microscope, I think that's what's referred to as the pathological one. The staging for that is a T3, N for Norman 2, V1, M for mother 0. So there's still some clear differences between the two, particularly the T number. So the radiological one was a T4A, whereas the pathological one is a T3. Also under the pathological one, there is a V number that's added in. So as part of this interview with Dr. Vasantham, we do unpack a little bit more about what these numbers mean. But at the end of the day, when I asked him, so am I a T3 or I'm a T4, his response was that I'm a T4. So although the pathological one, he said, is more accurate, I'm still a little bit confused as why I would be still a T4. But he did then go on to say, well, after the 6 courses, first 6 courses of chemo, they would scan and it might be restaged because clearly what they're trying to do is shrink the cancer and eliminate some of that. So it possibly could be restaged to a T3 after 6, but we'll wait and see. And there's still a little bit of confusion, if I'm perfectly honest, around some of the information that we talked about. Perhaps I didn't delve as much as I should have done in terms of some of the responses. But there is a nurse called Louise at the Spires Hospital, where I'm attending in Leicester at the moment. She was previously part of a colorectal ward, so she's nursed on that and seems very knowledgeable when I've spoken to her about some other things, and she seems up for me talking to her and probably unpacking further that conversation that's coming up with Dr. Vasantham. So I think that's probably something that I'll follow up with her on this one. So without further ado, we'll move into this interview with Dr. Vasantham. I hope you find it of benefit. So talking about the staging then.
Staging of cancer essentially explains the extent of the disease.
Yes.
Okay. So there's 2 ways of finding out the extent of the disease. One is on scans.
Yeah.
So you had CT scans and MR scans.
Yes.
So from that, your staging was a T4.
Yep.
Which means the tumor was coming out of the bowel surface.
Yep.
And involving another organ.
Yep.
And in your case, it was involving the peritoneum, which is sort of covering, which is on top of your rectum.
Yep.
Okay. And
what does that A stand for?
there's A and B. So
Right.
B is slightly more extensive.
Yep.
Okay. N2 means that it has gone into lymph nodes.
Yes.
And if it's more than a certain number, it's N2.
Yeah.
If it's less than that, it's N1.
So it's like multiple lymph nodes have been affected. Yeah.
And then M0 is it hasn't spread anywhere else.
That's metastasis, isn't it?
M stands for metastasis.
Yes.
So that's before your operation.
Right.
So once you've had your operation,
Yeah.
they send the samples to the lab,
Yeah.
and they cut the specimens and look at the cancer itself, and also look for all the lymph nodes.
Yes.
So on that, you come to what's called a pathological staging,
Yes.
which is the most accurate one. Okay. So what they found was piece of your large bowel,
Yeah.
which had a cancer but the staging there was a T3.
Right. So that was the radiological staging.
Yeah.
Yeah, which
So-
is the T4 or
T4
T4.
N2
Yeah.
and M0,
Yes.
which is there's no evidence of spread elsewhere, and also there is an additional letter called V1.
Yeah, notice that.
Yeah.
Yeah.
That's when they look at the tumor in the microscope, they found few tumor cells within the blood vessels.
Right.
Okay. So
Does that mean it could carry within the blood?
yeah, that's a risk factor.
Yeah.
So what you're having is chemotherapy up front,
Yeah.
and we will scan you after 6 courses. That's where
Yeah.
the 6 courses comes in.
Oh, okay.
And then decide whether there is enough shrinkage
Yeah.
for them to do an operation. Okay?
Yeah.
So that's something that we discuss with the surgeons, what we call NDT.
Yes.
Okay. They might say continue with the chemo for another 6.
Sessions.
Yeah.
Yeah.
At the moment, because of the COVID, they're not doing any operations.
Right.
Okay. No major operations.
Yeah.
So that's something that we need to decide after your scans,
Right.
after 6.
Yeah. Well, assess where we are
Yeah.
with in terms of the surgical availability.
Yeah.
Yeah.
So once or whenever you have your operation, they analyze the specimen.
Yeah.
Also.
Yeah.
And that will tell you another staging called pathological staging.
Yeah.
Okay. So that has a prefix of P before the T and
Okay.
whatever.
Yeah. Yeah.
So that is something you will have afterwards
Yeah.
when you have the operation. So those are 2 different stagings.
Right.
One is radiological, one is pathological.
Okay.
Okay. However, you've had treatment, so there is expected to be some changes
Right.
in the staging.
So restaging.
Yeah.
So currently I would be a T3 or a T4.
You are T4 at the moment.
T4.
Yeah.
Right. Yeah.
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 So once you've had your surgery,
Yeah.
then they will give us a staging, but taking into account that you already had some treatment,
Yeah.
so that's going to reduce the staging
Yeah.
in some way.
And you did talk about radiotherapy. So
Yeah.
at what point may we consider the radiotherapy?
The radiotherapy is a local treatment,
Yeah.
whereas the chemo is going to shrink your tumor as well as mop out any cancer cells
Right,
that might
yeah.
be floating around.
Yeah.
The radiation treatment is to make the surgical resection easier
Yeah.
and also reduce the risk of the tumor coming back
Right.
within the local area.
So would that be a given that I'd have radiotherapy before
That again
surgery?
is something that we will discuss
Right.
after your
After the
chemotherapy.
6-week course?
Yeah,
Yeah.
sometimes it will be after 12,
Yeah.
depending on how much shrinkage you have.
Sure. Yeah.
So those are things that we need to discuss with repeat scans.
Yeah.
Okay,
Okay. Brilliant.
so that's where we are.